I think it is an innovation. Lilly has come up with a non-peptide small molecule that's readily absorbable without food, water, or fasting restrictions. So it is an update to what we've seen with oral semaglutide from Novo. It does deliver approximately 11% mean body weight reduction and improvements in waist circumference, systolic blood pressure, and triglycerides. So I think overall, it's an enhancement to what we see on the marketplace. I think it does make a difference for patients who are uncomfortable with an injection, don't have access to cold storage. A pill is a significant improvement. As you know, oral semaglutide requires a 30-minute fast. You can only have it with a little bit of water. It needs to be taken first thing in the morning before any other medications. So it's just a bit of an administrative challenge for patients. And the Foundayo or Orforglipron is just an easier pill to take. Having said that, it does have a significantly higher incidence of GI side effects. So some patients may not be able to tolerate it. I think I do. First off, as you pointed out, Danielle, some patients just have a needle phobia or just a discomfort with needles, and the fact that they can take a pill is just easier. Additionally, I think some primary care physicians may have a slightly unspoken bias about not prescribing injectable medications, whereas a pill just feels more comfortable in their daily workflow. They're just accustomed to ordering prescriptions for pills as opposed to injectable medications. I think it's easier as an entry point for patients who may be seeking treatment for obesity. Somehow it seems psychologically easier to start with a pill, and if the pill fails, then escalate to an injectable. And then, actually, in some practices, including ours, we sometimes wean from injectables and move into oral medications for long-term management in patients who have achieved their weight loss goals. Lastly, in some areas, it's a challenge around cold chain infrastructure, meaning the injectables have to be refrigerated and pills do not. So if there's any difficulties just around maintaining a low temperature point and storage, the pill becomes easier. Either way, for some patients who really have an objective to lose quite a bit of weight, using an injectable is still the most potent solution. So Wegovy injectable semaglutide has roughly a 15% weight reduction. For patients who might try injectable tirzepatide or Zepbound, you're looking at 20% weight reduction. The orals are a bit lower potency. Oral semaglutides somewhere below 15%. Orforglipron around 11%. So the injectables are definitely more potent for patients who are comfortable with them. But to your point, a patient could start on an oral, see how they do, and if they fail that, they move to an injectable. And then, as I said earlier, some patients may wean from an injectable to an oral agent over the long haul, and those drugs are slightly cheaper on a direct-to-consumer basis. I think ultimately treating of obesity is a really complex disease. It's behavioral, it's genetic, it's environmental. Ideally, patients are receiving a behavioral intervention, a comprehensive lifestyle intervention along with pharmacotherapy. But for patients who are reliant on pharmacotherapy to achieve their weight loss goals, the more choices we have, the better. So an oral agent, as we've shared through this brief interview, just makes it easier for those patients who either aren't comfortable with injectable, don't have a mechanism to store the injectables, have a doctor who may not be comfortable prescribing injectables. It just gives us more options, and the more options, the better is really how I think about it.
Yeah.
Absolutely. So, as we just said, having a comprehensive lifestyle intervention that includes coaching, medical nutrition therapy from registered dietitians, a behavioral intervention, not only helps patients develop lifelong habits to sustain weight reduction should they ever choose to come off these agents. It also helps for patients who may plateau on these drugs. And additionally, we know that patients who are on anti-obesity medications plus a behavioral intervention have greater weight reduction than patients who are on either intervention alone. So as we think about how health systems and pharmacists can assist patients in navigating these medications and really getting the most out of them, understanding how to titrate them, understanding how to dose optimize them, understanding how to navigate the side effects associated with them, and encouraging patients to engage in a lifestyle intervention, either virtually through telemedicine or in person. I think these are all elements that pharmacists can assist patients in really getting the most out of these drugs and creating the greatest and most sustainable risk reduction possible when navigating obesity.